Hi, I'm Bill O'Reilly. Thanks for watching us tonight. Handling the truth. That is the subject of this evening's Talking Points memo. Well, this has been a very interesting week on The Factor as the whole country continues to digest my interview with President Obama last Sunday. And if you believe me, and I hope you do, all I was trying to get at was the truth. But as you know, some Americans have trouble with that.
Colonel Jessup, did you order the code red?
You don't have to answer that question.
I'll answer the question. You want answers? I think I'm entitled to. You want answers? I want the truth. You can't handle the truth.
Well, not to overdo the word, but it is true that some people cannot handle the truth. There are a number of important things being debated in America right now, so tonight let's cut through the fog. On immigration, the Republican Party now says it will not try to get reform this year. That's a mistake. 68% of Americans, according to a new Fox News poll, want the federal government to develop an immigration policy that allows some kind of pathway to citizenship for the undocumented. 68%. So the truth is, Republicans are hurting themselves by continuing to dodge the issue. On the subject of ObamaCare, despite the president believing the new law is functioning better, the truth is, it's still chaos. As I mentioned to the president, according to a recent AP poll, only 8% of people actually using the ObamaCare website say it's running very well. Nobody knows about the future, but right now, the health care law, hurting more Americans than it's helping. How about the IRS situation? The truth is that the powerful agency did target conservative groups for scrutiny. The IRS did misuse its power, but the president doesn't believe that, even though the evidence is overwhelming. On Iran, the Obama administration is doing the right thing. The truth is, if you do not engage the mullahs, they'll develop the nuke anyway and cause more trouble along the way. So the compromise with Iran is slowing down the nuke development and possibly getting that country to behave like a civilized nation. It's worth a try. On Benghazi, Libya, the truth is that powers that be in Washington did not control the situation before, during, or after. Did the president participate in a cover-up? We don't know. Will we find out? I believe we will. And finally, on social justice and poverty, the truth is brutal. 10% of Americans will always be poor because they are irresponsible in a variety of ways. 5% of the population is poor through no fault of their own, and those people should be helped. But continuing to develop a nanny state, as the USA is doing, by providing cradle-to-grave entitlements, not going to help the poor. Some of them will abuse the entitlements they're given. Some will settle for the minimum. The New Testament quotes Jesus as saying, "The poor you will always have with you." Doesn't mean we should not try to help the poor, but it does mean we should have discipline in the process. And that's the truth. And that's the memo. Now, for the top story tonight, reaction. Joining us from Washington, Sabrina Schaefer, Executive Director of the Independent Women's Forum. Here in the studio, Dr. Steve Adubato, a media analyst and author of the book, You Are the Brand. All right, where am I going wrong, Doctor?
Well, there's so many areas where you're right, Bill, but if you want to talk about where I think
I do. One wrong. Give me a wrong.
On the issue of the poor, here's the numbers that I look at. I'm not exactly sure where you get 10% of the people. Sounded like to me you were saying, listen, they're going to be the way they are. Let's leave it the way it is because we can't help them.
15% of the population, according to the census,
sure,
is under the poverty line. In breakdown of that, 10%, I believe, are poor because of irresponsibility. And I base that on substance abuse statistics, educational drop out of high school statistics, women who have kids by the time they're 18 with no husbands, statistic. And I'm underestimating that, I think.
Sure. The truth that I see is this. We have no choice but to provide them drug and alcohol assistance, to provide them child care for the women who want to work, who want to be a part of it but don't have a way to take care of their children.
You're in the theoretical.
No, it's not. It's not theoretical how you get child care, Bill.
No, my contention is this. 10%, no matter what you give or do for them, are going to throw it right out the window.
What are you going to do? My truth is not, I don't write the book, Bill.
Here's what you're going to do. You set up a safety net for the poor, all right? But they have to work for it. They have to drug test for it.
Absolutely.
They have to do things for it. All right. What do you say, Sabrina?
Well, I just think that, first of all, I agree with you, Bill, that I think that there's a lot of good people, right, on both sides of the political aisle who have good intentions, even if we disagree on policy prescriptions. But when it comes to the issue of poverty and social justice, I think one of the worst things is that the president and others in the Democratic Party sort of perpetuate myths about those people. And that's problematic because then those policies are set upon that. The one that bothers me the most is the wage gap, that women are in poverty because they only make 77 cents on the dollar to men.
We blew that up. 91% now is what women are making toward men. But, okay, so you guys are focusing on poverty. Did I make any other mistakes here? We went over Iran. We went over Libya.
I think Iran, it is worth a shot at peace.
We went over ObamaCare.
Oh, well, let me tell you where Obamacare, you're right that they screwed it up from the beginning, and I saw the interview you did with the president, and he is wrong to say, hey, listen, it's working better and give us a break. But I'll tell you where I disagree. I feel that it is the best way to go, even though the implementation has been horrible, because there is no alternative, Bill. I feel that the truth is this. Let me tell you.
All right, go ahead.
My truth is this. When you have, say, 30, 40 million Americans who do not have health care, unless there's another alternative that makes sense, you have to make this the best it can be, even though it's a flawed plan.
There is another alternative. But okay, Sabrina, go ahead. Go ahead.
Let me say one thing that I agree with Steve is that I think a lot of Americans agree with Steve that they still want a government-run health care problem. That is a big problem for Republicans right now. The question is, how do you put forth an alternative that people are going to understand and want to get behind? But one of the big problems that we're seeing is that the administration knew all of these problems, the security problems, the loss of income, the loss of jobs. They just didn't want to admit it to the American people. So unfortunately,
they oversold it.
Oh, absolutely.
Well,
they were just
the Republicans did nothing other than say the president's no good, it's a bad plan.
I'm not going to defend the Republicans.
Listen, my view is the Republicans' truth was that if we're against Obama, we'll win. And, Bill, frankly, that's not a plan.
Well, I mean, that's what I said about immigration. You got to put forth something better than just saying we're not going to do it. But on Obamacare and the 30 million that are uninsured, they already have Medicaid, all right, and they already have the emergency rooms that have to take people.
Charity care.
Now, what you have now is if you opened up the health care system in the private sector to full competition, and you don't limit what insurance companies can do state by state, then you drive the cost down for the folks. But you still keep your Medicaid, and I would open clinics. I would open federal clinics for free treatment and diagnostic care for the poor. You can do it without this colossus.
Here's my question, Bill.
It's not going to work.
Here's my question. If the market... My truth is this, that I'm a capitalist, as are you, and you've done pretty well. Here's the question. If that plan would work, if the capitalist system would support it, then why haven't we seen that before?
Because this is a power grab. By whom? By the Democratic Party. It's an absolute power grab.
But respectfully, Bill, if the people really wanted a different kind of plan, other than say the Obama
plan. They do now.
Well, they do now because
they don't know what it looks like to own and control their health care dollars.
They're just getting to see the tip of this disaster. When the doctors start walking out and not taking it, then
can't go back to the status quo, Bill. That was not a plan.
Let's explain to the American people what it was system.
I predict this will be repealed. All right, last words, Sabrina, go.
Well, I was going to say, let's explain to the American people what a system would look like where your health care dollars are not necessarily tied to your place of employment, where you own and control those health care dollars, where you can compete to buy in the individual marketplace the way businesses can, because you get the same tax incentives. There's so many good solutions. But you can't just cherry pick
the healthiest people. What about the poorest of the poor and the sickest of the sick?
Well, that's where you
don't make a lot of money off those folks.
All right.
No, we all want to help those people.
But you do it in, as I said, a disciplined way. Very interesting discussion. Thank you very much. Next on the rundown, Geraldo is right and I am wrong on his